We're going to take it in good faith. Yes. Okay, so we're here with a representative from Nizamiye Hospital.
Yes.
In the person of Dr. Chris. Yes, and it's so amazing to have him here because we're talking about something very important, something that most Nigerians neglect. Good morning, Dr. Chris. You're welcome to the show.
Good morning. Thank you very much.
How are you doing?
Good morning, Abuja. I'm all right.
Great. You look good, by the way.
Thank you very much.
I was just complimenting the fact that most times you see medical doctors and they're all stuck up,
Yes,
you know.
yes.
But like you look like you're a giant kind of doctor.
He's a
like,
G. He's a G.
you know?
He's a G.
Thank you so much.
Anyways, so today we'll be looking at undergoing medical checkups in Nigeria.
Yes.
Okay.
And it's interesting because I know that a lot of Nigerians do not, you know, aside from the scare of like a health crisis, they necessarily don't go to the hospital or even see a doctor. I mean, so it's very interesting that we're talking about this today.
Yes.
Yes.
All right. Okay. So, Dr. Chris, we're going to start by asking you why medical checkups are important for individuals. Okay. Just like Anna said that a lot of Nigerians don't go to the hospital to check up. Because for me, I cannot even imagine myself as healthy as I think I am.
I like that. As healthy as you think you are.
As healthy as I think I am, walking into any hospital for any kind of checkup. Some religious people will tell you, why are you inviting sickness?
I know. Very true.
Inviting sickness. So why is it important for everyone to do medical checkups once in a while? Yeah.
Okay, before I go into that, I would like to just explain what a medical checkup means.
Right.
Medical checkup actually means getting to see your healthcare provider and having your physical examination and examination done.
Right.
Also, at times, some screenings can also be done for you during the visit to the healthcare provider.
Right.
But reasons why a lot of people don't actually go to the hospital to check up on their health status is because a lot of people actually don't see it important, and also our health seeking behavior in this country, it's very, very poor. Some people actually prefer to use the money and eat than to go to the hospital and do a checkup when they are actually healthy.
Right.
But they forget to know that it's actually not best to stay at home. Even people that are healthy actually go to the hospital for a health checkup because it's very, very important in one's life.
Right.
Okay, because there is this thing they normally say, it's always stay safe than sorry. Okay?
Yes.
So it's better to always visit the hospital and check out your health condition. But a lot of people actually think it's only when you're sick you visit the hospital, but that's actually not the truth. The best thing is to have a habit of going to do a medical check. Some people actually do theirs once a year. Some do it every 6 months, and some do theirs 3 times a year. So depending on your pocket and how healthy you are, you can actually walk into the hospital and check yourself once in a while.
Right. Okay. So I think we have actually just looked at why it's important, to do medical checks. But what would you say constitutes a comprehensive medical check? I'm saying comprehensive because some people say, I went to the hospital and I tested malaria and typhoid and I'm fine, And some people will say, I had like a headache, so I just did for instance, the ladies, I just did like a mammo or I just did like my breast check and I'm fine. Do you understand? Okay. But for a comprehensive medical check, like if someone comes out now and the person has said, I'm just going to do a medical check, what would you as a doctor be thinking that person has done?
Okay. Actually, when someone comes in for a medical check, and normally it entails maybe when a person comes in, obviously, when I mean the physical examination, it entails the patient telling you his concerns, ideas, and his expectation from the whole process. And after which you conduct a proper physical examination and examination of the patient. And during that time, you can also elicit certain things that the patient didn't even know about. And after that, you send the patient to the labs to do some investigations and some screenings, which we're going to talk about later today. So, and when the results are out, you have to combine the whole thing you noticed from or you detected from the history, the examination and the investigations, discuss the outcome of lab results and your examination findings for the patient, after which you can make a necessary referral to specialists or any other doctor that may need to see the patient.
Right.
If at the end of the whole process you see the patient stable and you stand fit without any illness, you can tell the patient, okay, yeah, your health status is okay, you can come back for your follow-up maybe in 6 months or 1 year, depending on.
All right, Dr. Chris. Okay, in case you're just joining in, okay, we're talking about undergoing medical checkups in Nigeria. And you can be a part of the conversation by calling us up or sending a text to the number 081-78000947. Have you ever gone for a medical checkup? Okay, you're not sick. You just walk into any hospital and you want to check up yourself and all of that. So have you done that? And when last did you do that? Okay, so that is the question we're throwing out. So go ahead, call us up and tell us when last you went for a medical checkup. So Dr. Chris has also highlighted that it is very important for you to go for medical routine checkups at least 2 to 3 times every year. It's very, very important. And again, I'm going to be asking him this question again. What is health screening? I guess he mentioned that.
Yeah.
Yes.
Yeah. Just before the health screening, I'm not sure that Dr. Chris has given the lineup of what constitutes the medical check.
Routine medical check.
Yes.
Yeah.
So what are the constituents of the medical check?
Okay, it's actually very important. Even before you make a decision to go to the hospital to do a medical checkup, you also have to know what you expect during the consultation.
Right.
Actually, it entails maybe when you walk into the clinic, after discussing with the doctor, there are vital signs that the doctor needs to check. The doctor will have to check your body weight, he has to check your height. With these two, he will be able to calculate your BMI.
Right.
Okay. And advise
say that again?
The body mass index,
weight,
actually.
yeah.
That's what
I mean, how do you calculate? People keep asking me. So this is an opportunity for them to know. Please, that's why.
Okay. The BMI is actually calculated. You have to weight over height. Okay. And that's what constitutes the that's what we use to calculate the body mass index.
Fantastic.
And also, after getting the vital signs, you also have to check your pulse rate, your blood pressure, and your oxygen saturation. You'll also get to check your respiratory rate. After checking these vital signs, the doctor will now send you to investigations and screening based on your age, your sex, and your lifestyle status. Okay, so the medical checkup actually is not just walking, just getting malaria test done or typhoid test
because yes.
There are actually so many things you actually have to put into consideration at any point in time in our life. There are certain investigations we're actually supposed to do when you're between 20 to 30 to 50 years and even over 60. There are certain investigations you have to go to the hospital to check up yourself. Okay, for example, some people will tell you at the age of 16 you should start checking your blood pressure at least twice a year. Every 6 months you need to get your blood pressure checked. Okay, and also after the doctor has finished taking your vital signs, he can now check your age, your sex, and your lifestyle status and check the investigations he will have to send you for. He can actually send you to do a blood cholesterol test because cholesterol, when it's high in the body, it's actually very dangerous for the heart. It can cause cardiac problems for individuals. And also the doctor can also help you to get your viral hepatitis status checked, okay, to know if you have hepatitis or not, because from practice a lot of people actually walk in, they don't even know they have these infections, and these are things you can actually prevent, which is the main reason why you need a medical checkup, because the earlier you get to the hospital and get your tests done, the doctor can actually detect illnesses at the early stage, and with that you'll be able to prevent something serious from happening later in life. Although some people actually believe it's not really necessary going for a medical check. When you're healthy, why go to the hospital? Even if you go there, they may tell you some things that can cause so much anxiety and that will kill you more, but it's actually the best, because there are so many things people are living with they don't even know, and until you get to the hospital and get yourself checked, that's when you'll be able to know what your health status is, and with that you'll be able to follow properly and you live a longer life.
Okay. All right, Dr. Chris, you talked about vital sign and all of the things that should be checked out, and I wanted to ask a question from that angle. Okay, is that like a national standard? Because you mentioned different different things that should be checked. Is that what all hospitals in Nigeria do, or are there some people who do that, or are there some people who check this, or there are some people who do not check, some certain things? Yeah.
Like I said, it depends on individuals.
Okay, individuals.
Okay? So the doctor, maybe different doctors, maybe assess you differently. But there are basic things that should be done, like the vital signs are listed, like the weight, the height, the BMI, your pulse rate, your blood pressure. After that, the doctor can now go down and send a lot of investigations, like checking your cholesterol, check your HIV status, then do viral hepatitis test for you. Then depending on the age, the doctor can also start screening you for some malignant conditions. When I mean malignant conditions, I'm talking about cancers, like colorectal cancers, prostate cancers, breast cancer, and all that. And during the examination, the doctor will also have to do a clinical breast examination for you too. Some people may have some lumps they are not even aware of. So during the procedure, the doctor may be able to pick up that. Yeah. Then some men will also have to get their testes checked too.
Right.
So it entails a whole lot. So the doctor will look at individual, look at your age, and decide on what investigation that is best for you.
Fantastic. Okay, so let me go back to my question, the one I asked before now. Okay, what is a health screening and why is it important? I remember you mentioned it while you were saying something. So what is a health screening and why is it important?
Okay, health screening is basically the investigations, which is part of the medical checkup. There are screening tests we actually conduct for patients. Like HIV test is actually a health screening test. And a lot of people don't even know their status, and it's advised that you get your HIV status checked once every 5 years.
Right.
Another screening test you can do is a colorectal cancer screening. And that is advisable for anybody over 50 years. It's better to go to the hospital at least once every 2 years to get your to get screened for the colorectal cancer, and that we use the blood and the stool test for the screening. And also, ladies are also advised when you're over 30 years to have a clinical breast examination done too routinely when you visit your healthcare provider for your screening. Although self-breast examination is something they usually advise ladies to do on their own.
Yes.
It's also advisable when you get to the hospital, the doctor can also do the screening for you, but do the clinical examination. But the screening aspect involves the mammogram, and that is advised for ladies to go for that when you're over 40 years old.
Right.
It's not advisable to have your breast screening done with the mammogram when you're less than 40 years, because it may not really show anything
at the time.
Okay.
Right.
And another thing, you can also get for men over 50 years, they can also go for screening for their prostate.
Right.
Because a lot of people have prostate cancer and they don't even know, and by the time they are coming to the hospital, the disease condition has progressed to a very, very advanced stage that it will be very, very difficult to salvage this situation, because some of all these screening tests, when detected early, especially at the first stage, the chances of saving the person's life is more than when you come at maybe stage 4 or stage 5.
Right. So at what age would you advise men to start to do their screening for prostate?
Yeah, actually, there is actually a debate on that, but some people actually
because I've heard different things.
Yeah, some people actually believe at the age of 50.
Right.
But if you have a family history, or maybe someone in your family that died from prostate cancer, it's actually advised that you start maybe somewhat earlier, 10 years earlier than the 50 years you're supposed to do that. But if you check yours and your prostate is fine, you don't have any prostate cancer or any problem, then once every 2 years, although the Australians will tell you to do that maybe once every 2 years, but the Americans will tell you once every 5 years.
Yes.
But the most important thing is just to get your test done, and it's not just once. You have to have the habit of always going to your healthcare provider to get these things done at the appropriate time and when it's due.
Great. So we're going to go on a break, and we are still looking at medical checkups in Nigeria. Healthy Tuesdays, that's what we're doing right here. And this is absolutely powered by Nizamiye Hospital. Stay with us.
Identify with the rhythm on Rhythm 94.7 Abuja.
Tune in every Tuesday from 10:05 a.m. on the mid-morning cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital.
Oh yes, this segment is absolutely powered by Nizamiye Hospital, and we've got Dr. Chris here who is doing justice to reasons why we should get medical checkups. Yes, just in case you want to be a part of the conversation, you want to ask questions, you can send us a text or call 081-78000947, and I'm sure that whatever questions you have for today, even if you can't get it answered now, you can find your way to the hospital to make further, inquiries on those questions. So we're going to go straight into the next question, which will be what kind of health services are recommended during a medical checkup?
Actually, there's a whole lot. Okay.
Maybe you can just summarize. But before you start, let's take this question, yeah? So we can just add it to. Hello, good morning.
Hello, good morning.
Good morning to you, ma'am. What's your name or where are you calling from?
My name is Cindy. I'm calling from Area 10.
All right, darling. Go ahead. You want to ask Dr. Chris a question?
Yes.
Go ahead.
Please, I want to ask, what does it cost to do a medical checkup?
A full body.
Okay, you want to go over to Nizamiye to find that out, all right? We can't do that for you right now, but we can get your details, or we can get his details across to you so you can find out, or you possibly go to the hospital. Nizamiye is located where?
Just behind Cytec Estate in Bora.
Yes. Behind Cytec Estate in Bora, that's where the hospital is located. Life Camp. So you could go there and make your inquiries, all right?
All right, thanks.
Thank you, darling.
You're welcome.
Yes. Right.
But it's affordable too.
Yeah.
So going back to the question you asked, the doctor can start by sending you baseline investigations.
Right.
That will entail getting your CBC count, that's your complete blood cell count, done.
Right.
And also the doctor can also send you to do check your there's what we call the electrolytes.
Right.
The sodium, the potassium level, the calcium level.
I heard that a lot.
And
sometimes my mother's
some of all these things are not really some people move around and they don't even know that they have some of all these parameters in a level that is not optimal.
Right.
Okay, and some of them may not even give you symptoms early when it's serious.
Right.
And also the doctor can also do a liver function test done for you to check your liver, and also you can also do a kidney function test.
Right.
Because we have a lot of people come into the hospital healthy, but they don't even know that maybe they are currently having an acute kidney injury. Then when you do a blood test, the doctor may be able to see this and advise you appropriately.
Right.
Some people are also living with chronic kidney conditions and they don't know about it. But all these things are something that once you come to the hospital early, or you have a habit of going to the hospital for your checkups, the doctor may be able to get all these things on time, and it will be taken care of. Another condition is test they can actually send for you during your routine medical checkups is the thyroid function test, which a lot of people actually don't check, but I think it's very, very important for people to also check their thyroid function once in a while, because a lot of people may have some symptoms, they don't even know what it is, they just keep treating malaria over and over without knowing that maybe the thyroid function is high or low. So it's also very important, and if you go for a health checkup, all these things can be checked and be handled.
Can we break down the thyroid function? When you say thyroid function, what do you mean?
It's just the thyroid organ,
right?
Okay, and there are three parameters we actually check to check the functioning of the organ.
Right.
That's the thyroid stimulating hormone. That's the TSH.
Right.
Then we have the T3 and the T4.
Right.
So they can be high or low.
So people that have goiter. Yeah. Is that a malfunction of the thyroid glands?
It is actually.
Right.
Because actually in goiter, the thyroid level is not optimal. So once you go for investigation, the doctor can actually check, okay, although some people, even when they have goiter, the thyroid function may be normal.
Right.
Okay, but if the thyroid level is not okay, the doctor will not advise appropriately.
Right. Okay.
All right, let's talk about illnesses that can be detected during a health screening. I remember you mentioned cancer, but we wanted to be specific about most of all these illnesses that we can detect during a health screening.
Okay, one is during the physical examination, the doctor may check your blood pressure and may see a value that maybe you'll be wondering how come you're walking around with this kind of high blood pressure, because hypertension is actually known to be a silent killer. A lot of people actually walk around with very high
blood pressure
totally
that is nearly even incompatible with life, and they're still surviving.
What about low blood pressure?
Some actually come in with that, but that one will most likely bring you to the hospital. When you have a low blood pressure. It will cause you weakness and tiredness that will definitely make you go to the hospital. For your health check.
Right.
Most times high blood pressure, a lot of people come in, we have more of people that come in with high blood pressure. They come in normal, but once you check their blood pressure, it's very high.
Right.
Another thing is high cholesterol high cholesterol can also be detected through the test. And also, like I said, the thyroid conditions, you can actually do the thyroid test to also know if the thyroid is actually functioning well. Then also for people that come for screening, but that's for the middle age and above.
Right.
People can actually come in for maybe bowel cancer screening, even cervical cancer screening and all that. All these things can actually, there are screening tests that can be done for all these disease conditions, and if you come early and you have an abnormal test result, the doctor will refer you as appropriate and you'll be managed better. Like another one I didn't actually mention for ladies.
All right, doctor, let's just take this call. Okay, we get back to you. Hello, good morning.
Hello, good morning.
All right.
My name is Yinka.
All right, Yinka.
I'm calling from the area.
All right, Yinka, please go.
I wanted to ask the doctor, is there any particular age range for a woman to start getting worried from the checkup? You know, for women who start from 18 or 60 or thereabouts. Is there a particular age that one should now start getting worried and asking for the need to go for checkup?
Okay, all right, Yinka. All right, doctor, is there any particular age that a woman should start getting worried, going for checkups? I remember you mentioned that before, but just go ahead.
Go ahead. Probably she's just tuning in.
Yes.
As early as 13 years.
Right.
Is advisable to take your daughters to the hospital.
Right.
To get to introduce them to the doctor. They form the habit of getting used to the doctor. They can always open up to their doctor. So at the age of between 13 to 15 years, you should take your doctor to the hospital.
Right.
Although the girl may not get a pelvic examination done at that visit.
Right.
But the doctor may just check the normal general physical examination.
Right.
Then when you now get to the age of 18 to 20, or some people will tell you from 20 to 22, you also have to go to the hospital and get your pap smear test done, which is very important, and a lot of people don't know about it.
That's for cervical,
Yes, a lot of people don't know about it, and you can get your pap smear test done at the age of 18 and 19, but there are certain factors that has to be considered before you can get screened for all those things, because before you go, you also have to call your doctor to book an appointment, because you have to know what you expect, because you can't go to the hospital for your pap smear test done when you're menstruating. So you have to discuss with your healthcare provider. So at the age of 18 and 19, you should be thinking of getting your pap smear screening test done. Then once you get to 30 years, although breast self-examination, you can start from maybe even 20 years too. Then when you now get to 30 years over, you need to now start going routinely to the... Okay.
Yeah. All right, Dr. Chris, let's just take this call. Hello, good morning.
I'm calling back.
All right, Yinka.
My problem. I don't like hospitals. I don't like going for checkups, because the next thing they'll just start giving you all manner of tests to go and do. Is there any way one can overcome this fear? I don't like hospitals, and I'm sure there are thousands of people like me who don't like going to the hospital. How do we get over this fear?
All right, Yinka.
Sorry, madam. The truth be told, I know a lot of people are actually scared of visiting the hospital because when you get to the hospital, you'll be told some things that may scare you never even know about. Like some people don't like getting their HIV test done because they are scared. They feel the fear of knowing they have HIV will kill them more than living without knowing their health status. So I think it's still the best, because if you have a health condition you don't know about, if you go to the hospital late, it will be very difficult for even the healthcare personnel to help you. But when you go early, they can pick up these whole conditions early and handle it. Even some of them, it's not like once you go and they pick any disease conditions early, because most cancers you can't handle. Some of them are treatable, some are not treatable.
Yes.
Okay, so it's better to form a habit of going, get to the hospital, know what it is. So the doctor will help you and follow you up for years, and with this you can be managed better. You can live longer with less suffering than when you now come down to the hospital, in an advanced stage when the healthcare personnel cannot help you. It's going to cost you a whole lot to take care of your health, and also you'll suffer more.
Yes, so, at this point we're already looking at the benefits of a medical checkup. So what are the benefits are there?
Yeah, the benefit, like I just said a few minutes ago, one is that it helps you to save money. The more you go to the hospital and you pick all these things early, you spend less than when you're coming an advanced stage, because now they are now managing you most times conservatively, and that's going to cost a whole lot because there won't be cure for most of them. They will just manage you conservatively till when you feel much better. If you will feel better, actually.
Right. Sorry, just remembered, we didn't talk about infants a lot here. Okay. Don't they need medical checks? But we'll take this, and then you can answer. Hello.
Hello.
Good morning to you.
Good morning,
Yes, what's your name and where are you calling from? Your name, ma'am.
I'm calling from Abuja. My name is Tutu.
Okay, go ahead.
Hello?
Go ahead.
Yeah, my question is, you check your teenage daughter to see a doctor.
Okay.
So that the child can actually open up very well to the doctor.
Okay.
So is it possible to just speak to a female doctor to carry out whatever test, or a male doctor? Because leaving a teenage doctor with a male doctor all alone without sitting there, and then you not be CCTV camera there, things like that. I don't know. I mean, should we be comfortable with that? Maybe you should just decide to see a female doctor for your female daughter.
All right. Okay, ma'am. I share your sentiments completely. But the doctor would answer that.
Yes.
Okay. Yeah. If you're going to the hospital with a child aged 13 to...
A female. She's concerned about the female.
Yes. You can't leave your child alone because she's still considered... a child is considered as a minor till you get to the age of 16.
Right.
Some will even tell you up to 18. So you can't allow that child alone with a male doctor.
Right.
You have to be in there. With that, you won't be worried about what she just talked about.
Right.
So at the age of 18, a girl is no longer considered a minor.
Right.
Although there are other situations whereby you can actually say a minor... you can, in as much as somebody is less than 16, but the mother shouldn't accompany the child in there for a physical examination.
Right.
Okay. But the best thing is, if the child is still a minor, you can excuse your daughter and alone with the doctor while you're out there for the doctor to conduct the examination. But from the age of 18, someone can actually visit the doctor on her own and decide, okay, they have right to.
Let's just take this last call, Dr. Chris.
Yes, we're going to take this one. Hello, good morning to you. Hi, Carl. How are you doing? Do it real quick, Carl, okay? We have less than 2 minutes to wrap up, right?
Okay.
Yeah.
Mine is an observation.
Okay.
My observation is this.
Okay.
The way of manner medical practitioners treat the people, for some is really unprofessional. That's why a lot of people are scared of going for medical checkup. Someone could be very, very alright, only for us to get to the doctor and come out with another different problem. That's why I found it very hard. Very clear. What's the problem? He just had one bombshell. So I think there needs to be an upgrade in the delivery of information and the way we handle people. The psychological aspect of it needs to be very handled with much carefulness.
Right.
Thank you so much.
All right. Thank you, Carl. Right. Okay. I feel this has to do with a lot of psychological and, mental, dealings when it comes to how you approach patients. Yes. Do you get? I agree with him. Not every doctor. I don't know. Sometimes I think it's a mood. I don't know. Sometimes you come in and you're really like in a very light mood and you really want to speak to your medical personnel, and then the reaction you get, I don't know if it's, backlog of work or this is in their own phase or something. I don't know what usually happens, because most people complain about this.
Yeah, Nigerians, I won't really say, I don't even know, I won't say Nigerians because I don't know how, I don't have any figure to report this, okay? It's actually best. People move from one hospital to the other, and it's actually not good for your health checkups. Right. It's better to visit a particular healthcare provider, except on referral. When he refers you to another place, you go there. Right. With that, you get to know your doctor very well. Your doctor get to know you very well. Your doctor will know your family history, your family background, get to know your health status. History. Okay? Because the truth is that we need these checkups almost once a year or twice a year, because we live in a fast-moving world with hectic work schedule, and this stress can actually trigger certain things that we don't expect to happen to us. Something like hypertension, weight gain, even some gastrointestinal problems, and also anxiety too. And these things, if you don't go to the hospital, you won't be able to detect all these things. Okay. But I know a lot of people actually complain. They go to the hospital and you don't get the care you need. Even the doctors and the other medical personnel are not friendly, but I don't think this should scare you away from going to the hospital, because who will lose at the end is the patient and not the healthcare personnel. Right. But to save yourself from this, to save one from these whole problems, it's better to get to use a particular clinic for your routine checkups. With that, they get to know you, they'll be more friendly, and you get the best care, actually.
Okay. All right. So I asked about infants, but I think we're going to leave that for another day, because I know that if you start with infants, we're probably not going to end anytime soon, and time is fast spent. Yes. But thank you so much for coming through today. I mean, this is a mind-opening kind of, interaction that we had today, talking about screenings that we should get, HIV, cancer screening. You mentioned something about colorectal cancer. Yes. That's really cool. We mentioned the breast, prostate, and then for prostate too. For the men, I know most of the times, I feel like amongst the both sexes, the men are the ones that really don't want to even go to the hospital at all. Yes. So this is, Dr. Chris, encourage them. Final words for the show today. Why these medical checkups are important, especially for men. I know a lot of men that wouldn't go to the hospital till they are like bending somehow. Then they would now say, okay, let's go.
Yeah, but I think it's actually not easy, because a lot of people actually consider the cost too, because some of all these things you have to spend money, especially when you're healthy. While walking to the hospital to get a health check done, when you can use the money and buy some things you can use to take care of your family. But it's actually very important. I'm going to tell everybody listening to this program today to actually make out time and also make out some money too for these checkups, because you have to be healthy to enjoy this life, even to take care of yourself, take care of your family, and live a happy life. So it's good once in a while to go and get this test done. Okay.
All right, thank you so much, Dr. Chris. And yes, in case you're joining us right now, join us again next week Tuesday for another beautiful edition on Healthy Tuesday. And the show continues. Mid-Morning Cruise, of course, goes on and on with Blossom Matters. And of course, I have Awesome Ann here with me.